Welcome back, everyone. It's Dr. Teresa Toscano, your resident speech therapist who specializes in infant feeding and lactation. But more importantly, I'm a future mom to be on a mission to provide free feeding therapy to other moms because good speech starts with good eating. Okay, so today I want to talk about the first time your infant ever eats and the process that surrounds this beautiful moment. Now, all this information is coming from my lactation course I took, so I'll be taking off my speech therapy cap and putting on the lactation one. So as many of you moms know, or future moms can assume, but your baby should take their first feed within the first hour, again, give or take, but within the first hour after birth. However, instead of just swaddling your baby up in a blanket and placing them near the nipple, there is this really beautifully instinctual 9-stage progression that your child goes through that is initiated through the practice of skin to skin. Because I'll be using the term skin to skin often throughout this video, I just want to define it and describe it. It's really not complicated. You can probably already ascertain what it means, but essentially you take your baby that's bare and you place it on your bare body. You know, this is mom, it can be dad, but typically this is mom, and you just allow this continual skin to skin, touch to touch, contact between you and your baby. So now going back to feeding, the number one thing to do to initiate the best feeding outcomes from the beginning, from the jump, is to initiate the skin to skin contact in the hospital. And I mean immediately, right after birth. The baby has just come out of you, either vaginally or C-section, and that baby is placed right on you. Now, some people may say, no, we need to either stitch you up if it was a C-section, or let's clean the baby, or we have to first provide, all the necessary treatments for the baby first, and then we'll give them skin to skin. No, they can do the cleaning, the care, the stitching, all on you, skin to skin. So don't let anyone tell you otherwise. The only time this may not be an option, of course, is if there is something medically necessary where the doctor really has to take care of the baby. Maybe they're preemies, they need that extra TLC. You need a little bit of extra care, but besides those exceptions, immediate skin to skin. From this contact, your baby starts this 9-step process that helps the babe orient towards the world, towards you, mom, and as this whole point of the video, towards feeding. So what are these 9 stages? I'm just going to list them first, and then I'll go through them step by step. I'll go over the timeline and what you should see when this is happening. So the 9 stages are birth cry, relaxation, awakening, activity, crawling, resting, familiarization, suckling, and then lastly, sleeping. This process can occur from 1 to 2 hours again, and this depends on, how fast your baby regulates and how fast they move. The process might take longer if the baby couldn't be placed immediately on you. So if there's any sort of delay, this again may make it from 1 hour to 2 hours. So let's go into it. So the first stage is the baby cry. This occurs within those first few seconds of birth. This is their war cry. They're out in the world, and this is what everyone wants to hear. Their lungs have expanded. They cry. Everyone can kind of relax because the baby's awake. The next stage is relaxation, and this occurs right after the birth cry. Again, placed on you skin to skin, and they're relaxing. They just did a lot. You went through a lot. They went through a lot. 1 second the baby's happy in your womb and you're doing everything for them, and now they have to breathe and blink their eyes and just do everything they have to do on their own. So they need a time to just relax. Their heart's regulating. They need to warm up, and with that, actually, mom's body is helping them warm up, and studies have shown that that's better than a warming blanket. Now, the next stage is the awakening stage, and this can occur between minute 2 to 4, again, depending on your baby. And this is seen as really kind of small movements of the head. Maybe they're going side to side, up and down, small movements of their limbs and their shoulders. And you might even see a little bit of like mouth activity with opening and closing. But again, it's really small movements. The next stage is the activity stage, and this occurs between minute 4 to 12. And during this stage, you will see intentional movements of the limbs, the head. They almost seem like they're determined to try to move. They're kind of pushing without really moving. Maybe they're rocking a little bit. And you'll see more activity of their hand movements around their mouth. But they're not actually doing anything. They're not actually moving. Because then the next stage is where they're actually doing that, and that's the crawling stage. And this occurs between minute 18 to 54, and you actually will see the baby push, slide, leap up even towards the mama's breasts. And again, they kind of start a little bit lower, and now they're moving up. So after the crawling, they have to rest. Now, remember, they're new with everything here. They've just done a lot. Rest can actually occur between any of these stages, but statistically and documented wise, they usually see this between minute 13 to 46. But essentially, they're taking a pause, and this could happen frequently. They're doing a lot. So now they're at the breast, they've just crawled their way up, they've relaxed, and now we're at familiarization. And this can occur between minute 24 to 62, and all this familiarization is happening actually at the breast and nipple area, where the baby, again, starts to make maybe some solicited sounds. They're moving their hand towards the breast, they're touching the nipple, they're massaging the breast, and this has actually been shown to help with milk production. They're bringing their mouth towards the breast, maybe their tongue comes out, they're licking the area, because they're really just familiarizing themselves with what's going on. And you'll actually start to see some suckling attempts at the breast. So the baby's at the breast, they're familiar with the area, and now they can begin suckling. This occurs between minute 39 to 90, and this is where the baby actually self-attaches and begins to suckle at the breast. And moms, this is the first time they're feeding. It's such an amazing process. So they've done all of this, they've crawled, they've suckled, they know what's going on, and now they can sleep. They just went on this entire journey. This can occur between minute 52 to 108, and your baby falls asleep. And remember, they have spent 9 months knowing what your heart sounds like, and so when they're by your chest, they can recognize your heart, they just had a snack, and they can rest. And that is it. Those are the 9 stages. It is such a phenomenon that babies instinctually go through this. Now, why is this important? Because yes, there have been babies in the past, they've been swaddled, they're placed on mom, they're given to dad, and they have been able to really feed fine. But if we want to talk about best practice, because this is best practice, is that skin to skin is really important because it is shown to help babies recover from birth. It helps baby learn how to attach to the breast. And it really helps with mom and baby bonding. Now, the wonderful thing about skin to skin is that if there is any delay in it, again, due to maybe hospital policy, medical necessity for baby or mom, or you just have a mom that, went straight to bottle feeding, but now kind of has a change of heart and wants to go to breastfeeding. What's amazing is that skin to skin can be initiated at any time of your child's journey. And I want to emphasize that because during my lactation course, it was the number one thing to start with when a counselor is troubleshooting a feeding problem. What are some examples? The baby won't latch on. Start with skin to skin. The baby's refusing to eat. Start with skin to skin. My baby's not comfortable at the breast. Start with skin to skin. My baby won't stop crying. Start with skin to skin. My baby has colic. Start with skin to skin. My baby has Down syndrome and I would really love to breastfeed. Let's start with skin to skin. Now, not to say that this is the solution for all these problems, but this is really where you start because there is nothing really more powerful than that bonding between baby and mom. And so that's it for today. Thank you for spending time with me learning about your infant's first ever feeding experience and the beautiful 9-stage process and journey on how infants get to that first feed. Remember, I wanted to provide you this knowledge so that you know what to look for as you and your child start this journey and advocate for what is best practice. If you found any of this helpful, be sure to subscribe so you don't miss out on any future videos. Again, I've got a lot of topics and ideas that I want to just talk about, and I'd love for you to be a part of it. All right, Dr. T signing off. See you soon.